Welcome to Ulosca channel. Access all nursing practice questions. ATI RN Fundamentals Exam. Practice questions with answers.
Question 1. A nurse is caring for a patient at risk for falls. Which action should the nurse take? A. Place call light out of reach. B. Ensure non-slip footwear. C. Use restraints. D. Provide sedative. Which one is the correct answer? The correct answer is B. Ensure non-slip footwear. Explanation. Non-slip footwear helps prevent falls by providing better traction, which is especially important for patients at risk due to weakness or mobility issues. Question 2. A nurse is measuring a patient's vital signs. What is the normal heart rate range for an adult? A. 60 to 100 BPM. B. 80 to 120 BPM. C. 50 to 70 BPM. D. 90 to 140 BPM. Which one is the correct answer? The correct answer is A. 60 to 100 BPM. Explanation. 60 to 100 BPM is the normal heart rate for adults. A heart rate outside of this range may indicate underlying health issues like bradycardia or tachycardia. Question 3. A nurse is teaching about wound care. What should the nurse instruct the patient to do? A. Clean with hydrogen peroxide. B. Keep wound dry. C. Change dressing daily. D. Apply heating pad. Which one is the correct answer? The correct answer is B. Keep wound dry. Explanation. Keeping the wound dry promotes healing by preventing infection and moisture buildup, which could lead to complications like maceration. Question 4. A nurse notices swelling around an IV site. What is the priority action? A. Flush IV. B. Apply warm compress. C. Discontinue IV. D. Notify provider. Which one is the correct answer? The correct answer is C. Discontinue IV. Explanation. Discontinuing the IV and restarting it in a different location is essential to prevent further complications such as infiltration or phlebitis. Question 5. A nurse administers morphine. What is the priority assessment? A. Respiratory rate. B. Blood pressure. C. Temperature. D. Oxygen saturation. Which one is the correct answer? The correct answer is A. Respiratory rate. Explanation. Respiratory rate should be assessed first after administering morphine because opioid medications like morphine can depress respiratory function, potentially leading to respiratory distress. Question 6. A nurse is assessing a 10-year-old child. What is a normal finding? A. Enlarged lymph nodes. B. Respiratory rate 30 BPM. C. Heart rate 100 BPM. D. BP 110 per 70 mmHg. Which one is the correct answer? The correct answer is C. Heart rate 100 BPM. Explanation. Respiratory rate 30 BPM and heart rate 100 BPM are normal for a 10-year-old. These values indicate a healthy cardiovascular and respiratory response for children in this age group. Question 7. A nurse uses the numeric pain scale. What indicates a level 7 pain? A. Mild, manageable pain. B. Discomfort, manageable. C. Intense, debilitating pain. D. Dull ache, no interference. Which one is the correct answer? The correct answer is C. Intense, debilitating pain. Explanation. Level 7 pain is described as intense, significantly affecting the patient's ability to perform daily tasks or engage in normal activities. It requires immediate intervention. Question 8. A nurse is teaching a post-cholecystectomy patient. Which statement needs more teaching? A. Walk to prevent blood clots. B. Avoid fatty foods. C. Shower instead of bath. D. Take pain meds as needed. Which one is the correct answer? The correct answer is D. Take pain meds as needed. Explanation. Pain medication should be taken regularly as prescribed, even if the patient is not in severe pain. This helps prevent discomfort and supports healing after surgery. Question 9. A nurse teaches lifestyle changes for hypertension. Which statement shows understanding? A. Eat more salt. B. Exercise to reduce stress. C. Drink more caffeine. D. Avoid exercise. Which one is the correct answer? The correct answer is B. Exercise to reduce stress. Explanation. Exercise to reduce stress is a key lifestyle modification for managing hypertension. Regular physical activity helps lower blood pressure by improving heart function and circulation. Question 10. A nurse is reviewing a CBC. What is included? A. Hemoglobin. B. C-reactive protein. C. Platelet count. D. Prothrombin time. Which one is the correct answer? The correct answer is A. Hemoglobin. Explanation. Hemoglobin is measured in a CBC to assess the oxygen-carrying capacity of blood, which is crucial for overall circulation and organ function. It can help detect anemia or other conditions.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.